So evidence-based medicine is what all physicians should be practicing. Evidence-based medicine refers to the standards of practice that are based on high-quality scientific investigation.
Once you're done with residency and engaged in practice, especially when you're in private practice, which is what I did for 12 years, you're busy taking care of patients, and it's kind of difficult to keep up with the shifting amount of knowledge in your specialty and what the current evidence-based practice is. I think that's the thing, is that the best physician can go stale over time if not sort of held to a certain standard. And so for the patient, you want your physician not only to be kind and caring and doing their best for you, you also want them to be as on top of the current medical knowledge as possible.
Well, there's some evidence and articles that can be put forth to us and see this is why it's important for you to do a timeout before you start surgery. It's not to waste your time, and it's not to delay the next case. It's because this is the evidence that shows it's safer for patients.
Well, 20 years ago we talked about evidence-based medicine. I think it's now, however, become more thoroughly ingrained. You need to have objective evidence for a therapy or a procedure being appropriate, and that's what's meant by evidence-based.
It's much more evidence-based than I was when I was in medical school, and I'm proud of it. I'm proud that we are looking at the evidence continuously, asking questions, even about things that were considered settled.
So the main goals of the board is to make sure that we're all practicing safe evidence-based medicine. Without board certification, we cannot guarantee that that's occurring. And the public needs to know that. Board certification gives not only us physicians the ability to brand ourselves as somebody who has gone the extra mile to make sure that we're up to date in what we need to provide for patients, but it also allows the public to know that, and to know that by having a board certification, the type of care they're going to receive is likely to be better and more evidence-based.